We know that hospitalization can be a traumatic time in the lives of patients and their families. It's only natural to be a little tense when you need surgery or some form of medical care and treatment that's going to require a stay at a hospital or even a visit to a hospital. And beyond just wanting to know that you or your family member is getting the highest level of medical expertise, you also want to be assured that they're being treated with respect, compassion, kindness, and attention. And here to tell us more about that component of it is Dr. Jason Golbin, who is the Chief Medical Officer at Catholic Health. Welcome, Dr. Golbin. Thanks for being here.
Good morning. It's always a pleasure to be here. It's a pleasure to speak with you, and this is a wonderful topic that I think that's important for the...
I love this, and I mean, I know just from my experience on the board for a lot of years, you know, we used to kind of call this like patient experience. And that's an interesting thing. Like, speak a little bit about that, because it's a lot bigger than just, you know, did they smile at me when I walked in the door or something? This is a whole kind of continuum of care you're looking at.
Absolutely. So the first thing is when you come to the hospital or anywhere in healthcare, the expectation is that we're going to provide the highest quality, safest care, right? That's a given. Now, it's not really a given. We work really hard on that, and you and I have spoken about that other times.
Sure.
But above and beyond that, we want to make sure we're delivering the experience that patients demand, the patients deserve, from the way we interact with you to the way we respond to your needs and your concerns, and not just to you as the patient. What about your family and your loved ones that are there caring for you, especially in a hospital setting?
Sure.
We need to anticipate those demands or needs and respond to them.
And in a lot of ways, like on the other side of that, like that's a hospital's reputation, right? So like, you know, yeah, mom got well, but this happened, but that happened. So like those are the kinds of things that like you're running nonstop to kind of shore up, to make sure who we are is really what people experience.
I love that. So literally, we just had this conversation in the green room with the person who had been sick, and how was the experience of the care? Again, everybody expects that quality, but it's the other things that make it different. So we work really hard, top to bottom in our organization, to make sure we're delivering that experience. We say we put patients at the center of everything we do.
Yeah.
And by doing that at all levels, do we drive to the better, that really incredible experience that we want?
Funny thing, my mom was in Good Samaritan Hospital one year at Christmas. And my dad continually talks about the steak dinner we had on Christmas Day there. Now, again, great care, tremendous medical attention. All of it. My father remembers the steak dinner in the room on Christmas Day. Isn't that funny?
I know you hear that all the time. It's those differentiators that people remember. Look, if I give you we love food, you and I both. You can give two restaurants, same food, but if one restaurant treats you, makes you feel special, that we're happy to have you, we're lucky to have you as a client for us, as a patient in our building, that's where you're going to go the next time. And patients have a choice. Yeah. So we want to be that choice here on Long Island.
And the reality is that's not a game you're playing. That's the reality of what we're delivering in our treatment of people. So I know we have these values, because I remember when they were developed, I care. So speak a little bit about that, because I think that's an important thing.
Thank you. So at Catholic Health, part of our mission is our values of I care, as you said: integrity, compassion, accountability, respect, and excellence. We live and breathe that. So what we said was, to make sure we're delivering that incredible experience, let's define the behaviors that we expect under each of those values. So we set a standard number of behaviors underneath, and I'll give you an example. Some are as simple as come into the room, knock on the door, introduce yourself, right? That's a missing link in so much of what we do. But it's above and beyond that. We have one called eye to eye and heart to heart. So when you communicate with patients, and that could be the doctor, the nurse, the pharmacist, the housekeeper, whoever it may be, make sure you're looking at them eye to eye, like you and I, and make sure we're at the same level, heart to heart. If the patient's sitting, you sit. If the patient's standing, you stand. Really want to enhance that importance of communication. So some of them are simple like that, but I'll take to the next level. We work on teaching empathy. So sympathy, I will say, for many people is easy. Empathy, understanding patients' emotions and meeting them at the emotional level they are, that's hard. I'll give you an example. So you know I'm a lung doctor, right. In real life, right? Not anymore, I guess. You know, and for a long time, our job was to make lung cancer diagnoses. And my job was then to make the diagnosis and then get the patient to the surgeon and the oncologist, whoever they need to be. Patients would come and see me, and I would say, hello, sir, I have your results. Unfortunately, you have lung cancer, but I've already arranged. You're seeing the surgeon tomorrow. You're seeing the oncologist on Wednesday. And I didn't realize they were still stuck back on, I have what?
Right.
I just didn't. So here I was thinking I was being this incredible communicator, but I think I was missing their empathy. So now we actually teach, let patients react, name their emotions. Say, I can only imagine how upset this is, how earth-shattering this is, and pause. And then we solve. We're solvers in healthcare.
Of course, yeah.
But we teach that level of empathy.
Now, let me ask you this. How do you measure it? Because I think people would be interested in that. Like you could say, oh, we do that. But there's literally like a kind of scientific way that you evaluate this so that we actually know how we're doing, right?
Yeah, so the government helps us with that. The government loves to help us with that. So we survey essentially all patients that come into hospitals and actually in offices and everywhere. But let's look at the hospitals. It's called the HCAP survey, which stands for Hospital Consumer Assessment of Providers and Systems. So very, very interesting. They're looking at the providers, the system of the... So they're not asking, did we give you the right antibiotic? Did we give you the right treatment? Again, that's expected.
Yeah.
And we work on that.
Sure.
But tell me about how we communicated. Did we treat you with respect, compassion? They want to know that. So we measure that. And we get that regularly. And then we look across the board, how are we doing in Long Island, how are we doing in the state, and how are we doing in the nation?
That's amazing. It's a great thing because I think people don't often realize, like when you get asked to do a survey and you're in the hospital, that really holds a tremendous amount of weight, and it's worth really thinking about your experience when you're there too, right?
Absolutely. Those results are critical for us. We share those results throughout our organization. We share them at every level, all the way down to the frontline staff, and we let them hear the feedback that our patients are giving us. It's very, very important to react to make sure if there's something we could have done better, let's do it better the next time.
And I just want to highlight something you said earlier, too, that it really does involve everybody in the hospital world, in a sense, the whole culture. So I'm walking in, this has happened to me not long ago, I'm walking into St. Francis Hospital, and the security guard could not have been kinder, more welcoming, and nicer. Not just to me, but to everybody who was coming into the hospital at that time. And I said to myself, is there a better front man to have than this guy? He's terrific. That's kind of what you're looking for, right? Like even so that my relatives, when they come to visit me, my friends, when they come to visit me, they feel that their visit is important too because they've been welcomed. They're not an intrusion.
I love it. So two pieces to that story. First of all, we train the entire building, right? From the security guard. Anybody who touches a patient or touches somebody who touches a patient gets trained in our organization. So to work for us, you need to be trained in patient experience. We start on day one of orientation. Wow. Spend 3 hours in the afternoon of orientation just talking about what experience means to our patients and how you can impact that. But I'll take it one better. We even train our physicians. We train all of our clinicians. Actually, we were one of the first in the nation to say to be credentialed to work in one of our buildings, you need to train in not just quality and safety, but in patient experience as well.
That's a great idea, and it's so important. Now, I know there's a 5-star rating, and I want to brag about that. So tell us a little bit about that.
So part of where the HCAPs, that survey results go to a lot of publicly reported scores, like the Leapfrog Safety Score, like the CMS 5-star score.
And you read about those in the paper. People see those.
They make the paper all the time, good and bad.
Right.
But it's there. It's out there. So those results matter to us, right? We have some campuses that do extremely well. I'm going to call out St. Francis Hospital. Sure. St. Francis, I'm going to brag about 22 Leapfrog A's, 22. It's almost every one that you could possibly get. CMS 5-star, best possible score. So they're really setting the mark for us. Now, we want to raise everybody in our organization to that level. So we take those best practices from St. Francis, like that security guard example. I laugh, I was chuckling when you said that because I've heard about those security guards at St. Francis over and over again. They are delivering that exceptional, that differentiator.
Yeah,
right? Again, it's not just the medicine we're giving you, it's that differentiator. And then we're spreading that through the organization to continue to elevate our whole Catholic health organization to the St. Francis level.
That's a great thing. The guy's name was Carmine, by the way. Yeah. Because you don't forget a good experience. Right? I mean, you don't forget a bad one, but you never forget a good one either. And I it was months ago, and I'm in the hospitals all the time.
And you still remember his name.
I remember his name, of course.
I love
it makes
that.
A difference,
Again, look, it's 2 restaurants, same food. It's the experience that there's. Patients have a choice, and we want that choice to be Catholic health.
Yeah, I agree. Before we say goodbye to Dr. Golbin, he responds too. If you write to him, he responds, and so does his office. If anybody has anything that they would like to say or share or an issue, he does respond right away. I know that.
That's how we learn.
Yeah, so that's great. Thanks for being here today. Glad you're here.
Thank you so much. It's a pleasure, as
Congratulations, too.
always. Thank you.